My name is Jamie and I'm a nursing student, and today I'm going to be demonstrating the placement of an NG tube using my general principles and safety practices and follow my 11 medication rights. And so I would start by verifying my order for an NG tube and making sure that I have the appropriate reason and the appropriate equipment and the appropriate tubing. And I have all of my stuff set aside and everything's been verified. So then I would go ahead to the patient's room, knock and introduce myself. I'm going to provide privacy and I'm going to explain the procedure to the patient, explain why we are doing it, the reasonings, and any possible discomfort that they may experience during the procedure. Then I'm going to identify my patient using my 2 patient identifiers. I'm going to ask for their first and last name, date of birth, and match it to their wristband, and that matches. So then I'm going to start by doing my focused assessment and listen to their lung sounds and their abdomen sounds.
Hi, my name is Caitlin. Today I'm going to be demonstrating on how to insert a nasogastric tube. First things first, I'm going to do my general principles and safety practices. I'm going to do my 11 medication rights of administration if needed. I'm going to do my
And then when I go to listen to their abdomen sounds, I also want to be assessing their abdomen for any signs of distension.
I'm going to
or kind of problems.
My procedure.
If there were signs if it was evident that there was some distension, that we would just get some circumference measurement on the abdomen. But my patient's fine, sounds were all good, there was no distension. So now I'm going to ask my patient to block one nostril one at a time and to breathe, and to determine which nostril has the best airway, and that's the nostril we'll be using. Today we've determined that the left nostril would be best for the use. So then I'm going to go ahead and measure my tubing.
Oh, I was like, I'm gonna have them sneeze.
Oh no.
Going to go from the tip of the nose to the tip of the earlobe, and then down to the xiphoid process, to the start of it. And at that point right here, I'm going to go ahead and mark that with a marker or a piece of tape.
First off, I'm going to do my 2 patient identifiers. I'm going to assess for allergies.
There we go. And I'm going to make sure that my patient is in an appropriate position. She is at 45-degree angle, and I've had the bed put to a good working height.
I'm going to do a
And I want to put a towel or disposable chuck across their chest.
And that, the right side works better.
And I want to make
clear than the left side.
sure that there is an emesis spin and a box of tissues within reach. I want to get my pH strip out and ready.
I'm going to wash my hands.
And then I'm going to go ahead and put on my clean, or do my hand hygiene and put on my clean
I have
gloves.
described to the patient of what this procedure is going to consist of. This is just to catch any type of mess that could happen. Now I'm going to take
Alrighty, and so I'm going to go ahead and grab my tube, and I'm going to put lube on the tip
measure from the nose to the
of the
ear
tube,
to the xiphoid process. So insert
and I'm going to
here,
instruct my patient to tilt their head back against the pillow.
and then down to the xiphoid process. Okay.
And as they tilt their head back, I'm going to insert the tube along the floor of the nose,
Next, I'm going to put this back in here.
and I'm just going to gently
And
insert
I'm
the
gonna go ahead
tube.
and mark this
No
with a
excessive
marker
force.
and apply
During this
tape.
time, I'm also checking and monitoring my patient for any signs of distress, any kind of aspiration or problems. If there were, we would discontinue
Next,
the
I'm going
procedure
to
and
don
remove the
on
tube.
clean gloves.
Once the patient coughs or gags, it indicates that I have hit the pharynx, and at that point, I want to instruct my patient to go chin to chest, and I'm going to instruct them to swallow. I may supply them with a glass of water to help with their swallowing. So as they swallow, I'm going to advance the tube further, using no excessive force.
I'm going to take
Swallow,
the end of my tube,
advance, swallow,
and I'm going to apply
advance,
lube to it.
swallow, advance.
And then we're
And for
going
the
to
video's
here.
sake, the tube would have gone to where the marker is, but we can't get the tube to go through the mannequin very well.
But in this
So
case, my
we
patient is not in
are
the
at the
water,
point
so
where
I'm
it's at the
going
marker. So I would go ahead and loosely
to
secure.
lean the head back, and then I'm going to insert the tube, and every time that I go up, I'm going to tell them to swallow. So, you swallow for me. Swallow.
So loosely secure.
Swallow. Swallow.
And then I'm going to check the stomach contents by aspirating some of the content from the tube.
And then I pick a spot.
So
This is how I
I
know
would
that the pharynx.
put the
I
emesis
pick a
bin.
spot to where they either start coughing or gagging, and then I would have them bring their head forward, and then
When I'm aspirating the stomach contents, I'm looking for a greenish brown color, a little bit of yellow, like a bile color. If I get clear or anything frothy, it indicates I may be in the intestines or in the respiratory system.
Because this is not a real person. The
So
study is
we
not gonna
do have
help,
the stomach content color and consistency that we're assessing for. So I'll go ahead and remove this,
And
cap my tube back, and then I'm going to go over here to my pH strip, and I'm going to put the stomach contents onto the pH strip. And we're looking for anything 5.5 or less. So it is within range, so we are good. So now I'm going to confirm the placement of the tube even more with with an X-ray. So for the sake of the video, the patient's gone down for an X-ray and has returned, and X-ray has confirmed the proper placement. So now that the placement has been confirmed by X-ray, we are good to secure the tube a little bit more permanently. So I'm going to go ahead and tear that. I'm going to go ahead and grab the tube so it stays in place. Take that last piece off.
this house is in Capital City.
What are you doing, Caitlin?
But
Where are you going?
waiting.
Oh, I thought you were coming out.
No, I was getting more gloves.
Oh, never mind. I'm coming back to record you. Can we move some of the stuff? I got it in the video and I was like, I don't know if it's real professional. Why do you have this? That's from your room here.
Yeah.
Are you keeping it?
It's all in my bag.
I just tossed all mine. Cause we get another, we have more sterile gloves in our bag.
Let's start with
There we go. So once we get that more securely taped down, I'm going to go ahead and grab my measuring tape, and I'm going to want to measure the exposed tubing outside of the body using centimeters. And then I'm going to start at the tip of the nose
Yeah, I'm gonna do it today.
and bring it
Not
down.
What? Yeah.
And we're going to measure all the way down to the end of this tubing here and not include the aspirating end. And so for the sake of the video, because the NG tube wouldn't go all the way into the mannequin,
When you get to
it's a little longer for us to measure.
head back.
But I would typically just go ahead and measure the exposed tube as,
Pharynx is tight,
the
take
best
your
of
head to the chest and then open the swallows.
and I would take that measurement and I would document it. And I'm going to take my marker and reinforce that marking I made earlier, right here up at the nostril. And we would want to hook it up to a suction machine or
Keep your finger on it.
per order on any kind of machine that may be ordered, but we have no orders for a machine right now.
If I had a blood pressure cuff, I might.
So we're going to go ahead and point it upward
I don't think they put it in there, but
and secure it to the gown of the patient at the top here.
they just pump it up and let it run.
If you have one, they should have one up there you could borrow.
There we go. And if we were to have orders to hook it up to a suction machine or a tube machine of some kind, we would want to verify that that machine is working appropriately and is secured and set the way it needs to be set.
I'm gonna do my junior patient.
And I'm going to clean up my area, provide the patient some privacy, and I'm going to report and record the procedure that was done, document the measurements that I've gotten, and hand the patient the call light and exit the room.
What this procedure exactly